Hello and welcome to Spotlight on Education. I'm Bill Habermill, Orange County Superintendent of Schools. According to the Centers for Disease Control, autism is the fastest growing developmental disability in the United States. Autism affects the ability to communicate, respond to your surroundings, and form relationships. Early diagnosis is critical because children who receive treatment early on can experience greater results. Today we'll focus on the subject of autism and we'll consider the resources available to families. We have a panel of guests who can shed some light on this topic, so let's meet them now. To my right is Dr. Joseph Donnelly, the Director for OC Kids. Dr. Donnelly, great to have you here.
Thank you, Bill. I'm honored to be here representing for OC Kids and to share some of the great programs and dedicated people that are in Orange County.
Great. Nice to have you here. Nicole Ward is the Autism Program Director for the Regional Center of Orange County. Nicole, great to have you here.
Thank you so much. I'm honored to be here and I'm happy to represent the Regional Center of Orange County.
Good. Bonnie Gilman, a good friend and president of the Grandparents Autism Network. Bonnie, great to have you.
Thank you, Bill. It's a pleasure to be here and to extend our outreach to the community.
Great. And we have a parent and also somebody who is a educational program manager for OC Kids, and that's Hetty Hansen. Hetty, great to have you here.
Thank you for having me, Bill. It's a pleasure to be here and really nice to have a chance to have Stephen have a chance to be here with you as well.
Yeah. A little later you're going to meet Stephen, her son, and he was wonderful. We did a nice little interview with him a few minutes. So let's talk about autism. What are some of the signs of autism, Dr. Donnelly?
Well, the first thing is that children with autism have different behaviors from other children. They have problems with social interaction, delayed or atypical language, and often a narrow range of interests and repetitive behaviors. So for example, they may not make eye contact, they may not respond to their name, they might not have any language, or might not use the language they have to communicate with people.
Hetty, did you see that with Stephen?
The first things that we noticed with Stephen were irregular sleep patterns that developed around 9 months of age, and then when language didn't start coming, because he was running around, walking and doing all of the growth markers that you'd be expecting for a child as far as those developmental pieces, but the language was the initial concern.
Sometimes grandparents are the first to diagnose a child with autism because they're familiar with normal developmental markers. Mm-hmm. And if it's their child's first child, right, the first grandchild, the parents often don't recognize autism, but the grandparents do.
They see something that's just not right.
They have a sense that the developmental rate isn't on track.
I think that's a very important point. I really do. I'm an only child, and my poor mom, we relied on her for a lot of information about what was I like when I was little. And that is very true. I think grandparents fill a vital role for that. It's that gut level instinct.
Being a grandparent, you know?
Yeah.
Sometimes.
Yeah.
Sometimes. Nicole, now your agency really helps out with the early to 3-year-olds, doesn't it?
Yes, we do.
In what way?
Well, we're a private nonprofit corporation and we contract with the state of California and we provide services to individuals with developmental disabilities. In Orange County, we're very fortunate to have access to a variety of specialists who are very skilled in treating individuals with autism. And the services that we can provide range from infant stimulation therapy at a really young age, 4 months, even 2 months, to speech therapy, motor therapies, and behavior therapies.
That early? Mm-hmm. You can start to deal with them?
Typically you can start at a very young age, and it typically starts with infant stimulation therapy.
Wow, that's impressive. You know, there's some myths about autism, and I'd like to show you a short video about myths and some kids and young people who are talking about their autism. Let's take a look at that now.